Good morning. My name is Sheila Wake. I'm the representative here in Southern California for REXTAR X, Good Doctors USA. And this is Bob Sewell, the sales manager for Good Doctors USA. Today what we will be explaining to you is the REXTAR X, the usage of it, and all the features and benefits of the X-ray as well. So in my hand I've got the actual handheld X-ray. Weighs just a little over 5 pounds. That includes the lead shield, the scatter shield in the front. It is affixed to the nose cone, and you should never hold on to the nose cone when you're operating this machine. We have safety straps here. We also have a safety strap that the operator can wear around the neck, which is a really nice feature. Doctors seem to really like this because they know that their staff is not going to be dropping the X-ray. And for the price of the X-ray, that's a good thing. So we have a lot of different features that this will do, both manually as well as preset. To turn the machine on, you're simply going to press the button on the top here. You're going to press and hold, and then you're going to get a signal on the top that says 1.01, and that's just our software setting. Next, you're going to see the display of adult or child, and you can preset these so that you can have your 0.14 or 0.12, depending on if you're working on an adult or a child. Or you can actually increase or decrease the times by the up and down arrow. I find that most of the staff members like to operate the X-ray with the up and down arrows as opposed to a preset, because it's just a lot more accurate. And with all the different softwares out there and all the different sensors that are out on the market, everything is a little bit different. So you have better control that way. So it also has an automatic it shuts off automatically, I should say, after 2 minutes. That saves on the battery life. This little icon here on the upper right-hand corner shows how much battery life you have. When you're first using the X-ray, you want to make sure that you charge it for a full 8 hours so that the battery is fully charged. And then thereafter, you don't need to plug it in until you get down to that 1 bar. We have the adult and the pedo setting, and as you can see, as I toggle back and forth, we've got the molar, premolar settings. We also have incisor, canine settings for both adult and pedo. And then of course you can see that this is a little bit higher setting, so we're going to decrease that down to about 0.12, and then you can preset it. The hand strap is really nice to have if you wish to handle this with one hand. Otherwise, the neck strap, as I mentioned earlier, is really, really nice. And depending on whether or not you're right or left-handed, you can set this so that I like to wear it on my right side because I'm right-handed. And this way, I can put it off to the side, and I'm going to show you here in just a minute how I like to have the patient sit when I'm taking X-rays. By putting the X-ray over to the side on your hip, gets it out of the way of the patient, and it enables you to take a full mouth set of X-rays very, very quickly. So we're going to go into some positioning now. One of the things that I've noticed with some staff members is they're not real familiar with how to work the chair up and down when they're taking images on the patient. And so consequently, it takes them a lot longer to take X-rays. You can actually take a full mouth set of X-rays with our REXTAR X in about 3 minutes, which is really, really fast, and then they can go on to other duties in the office. So Bob, I'm going to start positioning you now and showing our customers and everybody else out there how to work with this.
Very good.
All right. We are eliminating, by the way, the use of a sensor. However, Good Doctors USA does have 3 really great sensors, a size 1, a size 1.5, and a size 2. But to save a little bit of time today, we're not going to be using those. Many assistants and hygienists do use the bisecting of the angle technique, which is really a great way of taking your images. And it takes a little bit more skill than aiming through an aiming ring and rod. So I'm going to demonstrate those major positions right now. First of all, what I ask the assistants and hygienists to do is assess the height of the patient when they get into the operatory so they can bring the chair up to their level. And notice I've got Bob sitting on the side of the chair as opposed to this way on the chair. And the reason why is so many offices still have cuspidors, they have monitors, they've got over-the-patient delivery system, they've got all kinds of things that are in the way. And those are just obstacles, in my opinion, that the assistant or the hygienist has to get around. So I get all of that out of the way, have the patient sit on the side of the chair, and then that frees me up to be in a 180 position to take my x-rays quickly and accurately. One of the things that I really want to emphasize here, this is where your fulcrum is. Okay, so you want to adjust your neck strap so that it's right at waist level, okay, or the x-ray is right at waist level. And the other thing that you want to make sure you're always doing is coming in parallelly. So with this bisecting of the angle technique that we're going to be showing here shortly, that allows me to do that. Don't want to see anything like this, because look what happens. If I hold the x-ray like this, I'm going to be exposed from here on down. And it doesn't matter if it's my handheld x-ray or any of the other ones that are out there on the market. Likewise, I see a lot of assistants going like this. Well, look what that's doing. It's really creating musculoskeletal disorders, and we don't want that at all. So you can step right into the patient this way, either from the right or the left side or center. Don't be afraid, just step right in, you're in charge. Okay, so for these posterior maxillary shots, I have the patient turn their head away from me for the right side and then slightly tilt their head toward me. So what I'm doing now is I'm bringing that root to me, and I'm now able to take a parallel shot and I'm still in a comfort zone. I'm not stretching my muscles or getting in a compromised position. And I'm bringing the root to me. And I like to take this shot with a little bit more maxillary forward. That way I have open margins and I don't close the margins. The same thing holds true on this side. For the anterior mandibular shot, always make sure that you adjust. I'm going to have the patient look up and make sure that you bring the chair down. I've already pre-adjusted this chair, but bring the chair down so that when you are taking the shot, all I see at the top of the nose cone is the lower lip. And again, notice I'm parallel. If you are a little bit more comfortable, or if that feels a little bit too high for you, bring the chair down a little bit more. And Bob, I'm going to have you look up. And so for me, that's perfectly fine. My elbows are still here at my side. I'm not stretching any muscles or anything like that. For an anterior maxillary shot, I'm going to have the patient look down slightly. And I want to bring the top of the nose cone right at the bridge of their nose. Okay? So I'm going to be just like this. Again, notice how I'm parallel. I'm bringing the root to me. I'm not foreshortening or overextending the tooth or anything like that. And you always get a great shot each and every time. Now, if you're using a XCP ring, that's going to dictate to you exactly how you're going to be using this x-ray, because you've got to go to the ring. And a lot of the rings and rods on the market are way too long. So you either have to cut it back. There's a really good ring and rod on the market called Click Stick. You can use any bite block with that. So any bite block will fit that system. But what I like about that is it's a shorter rod. You always want to make sure that the nose cone is right up against the cheek. So when I was in school, my instructors had a little saying, kiss the cheek. So Bob, I'm not going to kiss you, but I'm going to show you exactly what that means. You want to bring the nose cone right up there against the cheek. You can clean it afterwards. You can also put little sticky protective covers on it, but you want to get that right up against the cheek. Oftentimes with your XCP rings, the long rod prevents that. So you either have to cut the rod or use the Click Stick, which is a really great little system. But because of the low dose of our x-ray, if you pull it further away, lots of times the sensors are not going to activate. So if you're running into that problem, that's usually the cause right there. So get that x-ray right up against the cheek, and then you can take your image. Now, when you are taking the image with this x-ray, what you're going to be doing is, okay, I'm going to pretend now that the x-ray is on. You're going to press and hold the button here in the front. Okay, that's going to actually take the image. You're going to hold it down for 2 seconds. That activates the start. It's a safety, built-in safety feature of the X-ray. And then two seconds later, you're going to hear a beep. That's when you release your finger. And you don't want to release your fingers sooner than that, otherwise you'll get an error code. Normally what I do, if I get that, I just simply shut off the machine and then turn it back on again. But most of the staff get used to it really, really quickly. And press and hold for 2 seconds, keep your finger depressed, and then the image comes onto the screen. So I get asked a lot when I'm doing in-service trainings, how's the best way to clean the REXTAR X? I find that if you can stay with wipes that have a low alcohol rate, you don't want to put any acetone on here or anything like that. There's several of them on the market. Optum 33 is a good one. There's a couple of others. Just make sure that they don't have high alcohol content. You can use the plastic shields as well, both on the back side of the X-ray. So back here, you can place the little plastic shields there, as well as here, and even on the nose cone. So a little bit about the battery life on the REXTAR X. Battery charge will give you between 300 and 350 images. And then once it gets down to 1 bar, it's a good idea to recharge it again. It only takes about an hour to charge. So it's not like you have to wait overnight or anything like that. If you feel comfortable charging it during lunchtime, if it's getting a little bit low, that's fine. But normally 300 to 350 shots before recharging it. So hopefully many of you, after seeing this little video, will be excited about calling us for a demo on the REXTAR X. It's really become the thing of the present, and it's definitely how futuristically more and more offices will be going to handheld X-rays. We happen to have a lot. I have sold several in my lifetime of dentistry, and I find that this is really the nicest and the easiest one, the most staff-friendly on the market. So thank you from CDA 2019. Thank you, Bob, and have a good day.